Let me tell you something that most people know already, but deep down they don't want to say it out loud. Mental health in the United States is not taken seriously, and we pretend that it is. We talk like it is. We use big terms and buzzwords. We say access, we say trauma-informed, we say early intervention. But the reality for families who actually try to get help in the United States is nothing like the language and the trendy things that go on the internet that we like to use, the things that politicians make in speeches or are made in press releases by the government. I want to walk you through what it looks like in real life, not in theory. I'm a parent of 3 kids adopted from foster care. 2 of my children have special needs. And before we adopted them, our 2 oldest, they were abused and neglected in every way you can possibly imagine, and I am not exaggerating. It's something that we have lived with every day for the last 13 years. Trauma does not vanish because a child enters a loving home through adoption. It takes services, it takes providers, it takes professionals who know how to work with high trauma kids like mine, who know about reactive attachment disorder and other high trauma diagnoses. And it takes a system that actually freaking functions. And that is where things fall apart. For years, we have been fighting for mental health services for our 2 oldest. I'm talking real services, not inspirational posters or pamphlets. I mean hospital care, crisis stabilization, trauma treatment, wraparound programs that actually have consistency. I have sat in hospital rooms. I have sat in crisis centers. I have sat in courtrooms. I have stood with police outside of our home on the street trying to keep my children safe during a mental health crisis. I have been in meeting after meeting with every professional at the table, and they all agreed my children needed a higher level of care immediately. But what happened next? You guys know the story. It's always the same. Nothing. We were told that there were no beds. We were told that there were no programs. We were told that there was no space. We were told that programs did not exist in our part of the country, or for so many, we were told it was not covered by their insurance anyway, so what does it even matter? And it's tragic. The worst thing that we were ever told is try again in a week, in a month, when things got worse. Literally, they would say, things need to get worse before we can actually get them the help they need. Imagine hearing that when things are already as bad as you can imagine, that they have to get even worse. Your child has to reach an even more dangerous point before anyone can help them. And then they get to that point and they're like, oh, they're too bad now, we can't help them here. That is the reality many families are facing, not just my own family. Families across the country are being pushed to the edge because no one wants to admit the system is broken. No one wants to admit how big the problem is. I have made every call. I have done every piece of paperwork. I have been on every media, newspapers, national media, state media. My spouse has done the same. She quit her full-time job to handle their care. We have gone through every hoop. We have shown up to every appointment. We have followed every guideline laid in front of us. We have done all the things that we're supposed to do. And even then, the system is so overwhelmed that parents like me are left begging for the bare minimum services for their children or teen. And here is the part that kids and teens and veterans and families and communities need to hear. Most parents do not have a platform. Most do not have social media presence with hundreds of thousands of followers. Most do not have a voice that reaches beyond their immediate community, and they are drowning silently, and I refuse to let that continue. They are facing the same barriers, but without anyone watching or listening or advocating for them. They do not have the option to take their story public. We need to be intentional about mental health in the United States, not symbolic, not surface level, not a feel-good campaign about Mental Health Awareness Month that disappears on June 1st. Those things are good, yes, and I've been a part of them, but we need more. We need actual action. I'm talking about real investment, real programs, real staffing, real beds, real crisis teams that respond effectively, real trauma-informed community options that go farther than just a flyer or a pamphlet. Families should not have to reach a breaking point for the system to pay attention, because oftentimes by the time somebody listens, it's too late for a myriad of different reasons. Every person, every child, every veteran, every community deserves care before they become a danger to themselves or others. Every parent deserves support long before they are standing in a parking lot with police or in a courtroom before a judge, begging for options. Every community deserves a mental health system that takes human life seriously. And every veteran deserves the care that we promise them in this country. So what do I need you to do? I need you all to speak up. The mental health crisis, it's not getting any better, and because of cuts in federal funding, it's getting more and more dire. So I would implore you, tell your story, reach out, meet with others. We have to break the stigma around mental health and mental health care. And not just campaigns and hashtags, but real actionable steps. We have to call our leadership to account. We have to call the politicians to account. We have to call the private sector to account, the hospitals, the insurance companies, and say, healthcare is a right and mental health is healthcare, period. And if we want to stop the mental health care crisis in this country, we have to take it seriously, and we have to stop this cascading problem that happens again and again and again. We put Band-Aids on gaping wounds. We're not even triaging correctly. So I implore you, as a father, as a mental health advocate, as a creator, as a human being, tell your story. Write a blog. Contact your congressperson or senator. Contact your local politicians and state representatives. Talk to radio stations. Share your story, because when we act, when we amplify our voice, we will finally see change for mental health services in your communities, in your states, in your country, and outside of America, in the world. I implore you to do that. Thank you all so much.